Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Hi, everybody. This is Dr. Brian Jackson. Welcome to Healing Families Shattered by Addiction. Hope everybody is doing well. I just thought I would check in and talk about a topic that Di and I talk about from time to time, and that's about one of your family members going to get evaluated. And I think sometimes there's a lot of intimidation there. They don't know what an evaluation would be like should they decide that they might be interested in getting some help. And I also think it's important for families to know um, what the evaluation is about and what the evaluator is looking for when they meet with the individual. And I've done thousands of these, so kind of bear with me. I might kind of use my cheat sheet here and tell you like the obvious that we're asking for, and then maybe the reasons why we're asking for that information. And some of the information the person may not have, and therefore it's important to possibly have the family involved to answer some of the questions, not necessarily in with the individual. For example, we'll ask, like, on the paternal side and maternal side, was there any history of substance use or substance use disorders with a family member? And a lot of times people don't know what their grandparents did, or an aunt or an uncle. And, a lot of times there's family secrets or something that we don't talk about. So, in that case, we could consult, with the parents or another family member and say, hey, do you know of anybody that might have had a problem on either side of the family? Because, we're looking to see if there's, any genetic predisposition to this illness. And the predisposition genetically to this illness is very, very high. So if you think about in your family, maybe heart disease runs through your family, or hypertension, or diabetes, or cancer, God forbid, the questions they asked you at the doctor, because they're trying to see, could you have a predisposition to this? And so with alcohol use disorder, substance use disorder, whatever type of addiction it might be, uh, there could be a predisposition. And so for males, like myself, going up the paternal side, father and grandfather both were drinkers. And for men, if that's the case, going up straight up that line, the predisposition for men to display the behavior is 8 times as likely as somebody who was born into a family that um, did not have that situation. So when we meet with the patient or with the person, we want to know like name, rank, and serial number. Like are you married? Are you single? Are you divorced? How old are you? And do you have any children? Next important one is are you employed? And then tell me about your employment. We're looking to see if there's some consistency there. You've been able to hold down a job, or you're unemployed, and why are you unemployed? And, or if you've been jumping around from, job to job. Um, and then we're looking for really a history of alcohol and or drug use. And and that's a, self revealed information from the person that we're meeting with. And it's important to know, what drugs or alcohol they've been using. When was the onset? When did it start? Did it start when you were a teenager? Did it start later in life? Because that's very important in terms of development of the brain. So if you started as a teenager, we're probably up against some um, slowdown of the adult rational side of the brain because of what the chemicals do in terms of um, kind of stopping that growth and really reinforcing the impulsive side of of the um, of the use. And it's also important to find out if there's ever been any periods of time of abstinence. And that's always really important because a person can have a point of reference, as to what it was like when they weren't drinking, or let's just go with alcohol. When they weren't drinking, did they feel better? Did they sleep better? Were relationships better? Were they eating better? All of those things. And then there's some people that haven't really had much of a period of abstinence at all. And so, what we're trying to do is see, according to the American Society of Addiction Medicine, criteria that the person might meet to help us determine what would be a good referral for that person. So, say, for example, a person has not had any period of time of sobriety. They're either maintenance drinking or drugging at this point. And so, detox would be um, indicated there. And so detoxification is where your medically assisted treatment to make sure that you do not have any severe side effects from withdrawing. And so that can be managed with medications. And so in that case, an inpatient stay where the person is medically supervised, detoxed, gets up and running, gets some traction, where they're eating properly, sleeping properly, and get introduced to recovery, through group therapy and individual therapy. And then upon discharge, there's usually a continuum of care recommendation that might include intensive outpatient treatment, which is the next level of care I will talk about. So that would be a step down from inpatient. But intensive outpatient treatment is for people stepping down from an inpatient stay or somebody who is doing episodic drinking, where it's not all the time. And they would like to, and they don't meet the criteria for inpatient, where if they stop drinking, that, there's the potential for them to have some serious type of physical consequence. And IOP, I really prefer it. Some people need to go to inpatient and then go to IOP because you're out in the real world where you made the decisions to drink or to drug, and now you're out in the real world and you're trying to stay in good sobriety and recovery, faced with the same stressors that you may have had, prior to. So intensive outpatient treatment or outpatient treatment, I think, is very effective and should be a big part of somebody's recovery plan in terms of trying to get into good sobriety. Also, like to take a look at the medical history. Um, there's some diseases out there that are directly correlated. Let's stick with alcohol, because alcohol is the worst drug you can put in your body. Believe it or not, it's worse than crack cocaine in terms of the damage that it does to your body. So we have people come in with hypertension. I've seen people come in with hypertension, and when they stop drinking, believe it or not, their blood pressure starts to go down. So we got to keep that monitored, because you were probably prescribed medication if you were going to the doctor for your hypertension at a certain level. Now you stop drinking, blood pressure comes down. We don't want you over medicated, and therefore, your blood pressure could drop and you could get faint or whatever. Diabetes is another one, or people who are borderline uh, diabetics, because of the amount of sugar that's in alcohol. So you remove the alcohol, you remove the sugar. I've seen a lot of people where their numbers, as far as diabetes goes down. We're always looking at the liver too. We want to know a blood count of where the liver enzymes are. So liver enzymes, if they are high, um, it's of concern, because if the person continues to drink, there's a good chance that it can convert from uh, high liver enzymes to fatty liver, to fibrosis of the liver, and then finally, the one we really don't want, which is cirrhosis of the liver. Um, Alcohol can also cause, cancer. It negatively affects the reproductive organs. Um, and we're also looking to see if there's been any serious injuries or surgeries in a person's life. And if there have, were they under the influence when that happened? Um, Another important area that we look at is, the legal assessment. Have you ever been arrested and what have you been arrested for? So obviously, if it's a DUI, there was probably alcohol or drugs involved. Um, so just trying to look to see what is going on with those particular arrests, when they happen, were you using, and what was the disposition, of the case. Um, Medications is another thing. It's important to know what kind of medications a person is prescribed, because a lot of times some of the medications, say for example, you're prescribed an anti-anxiety medication, a benzodiazepine, and you're drinking alcohol with it. Alcohol is contraindicated for a benzodiazepine, and therefore people can have what is known as a blackout, which is a chemically induced amnesia. So it's almost like putting gasoline on the fire. So a lot of people don't know, and doctors, God bless them, like a lot of times they don't know how much the person is drinking, and so they don't really focus on the contraindication of, an autorespiratory depressant, which an anti-anxiety medication is. And then you've got alcohol, which is also a central nervous system depressant, which leads me to antidepressants. I've met people that say, oh, I've been on antidepressants for 5 years and I'm still depressed. Well, if you're drinking and you're taking an antidepressant, it's counterintuitive because um, alcohol is a central nervous system depressant. So you're really not giving the antidepressant a chance to do its thing. So really, to see if an antidepressant works, you need to have completely remove the alcohol and give it 4 to 5 weeks to get up to therapeutic levels. So, but if people are taking pain medication, I mean, there's a lot of, even hypertension medication or insulin, and you're drinking, it's just not a good combination. And it's just important to point out those facts to people, because sometimes it can be a real eye opener that they're really killing themselves on the installment plan. They're not giving their medications a chance to work as long as they're ingesting alcohol while they're taking their medications. Um, so the family assessment, we talked about that earlier. Like, okay, on dad's side, are there any uncles, any aunts, mom, dad, grandparent, or dad, grandparents, and the same on mom's side. And then we're also saying, beyond that, has there ever been a history of mental illness? Maybe not drugs or substances in terms of misusing them, because a lot of times the drinking or drugging is but a symptom of something else. And a lot of times people are self-medicating, and we see mainly, most people have a dual diagnosis, and the big percentage of them are some form of anxiety and or depression. So uh, we've come up with alcohol as a solution to calm down the anxiety, but it just makes matters worse. And so we really need to put time and distance between, the alcohol, and see what is going on. They might say, hey, Brian, after 8 weeks, I'm really anxious, or I'm having trouble sleeping. And so then we can address that with medication assisted treatment with non-addictive medications. And so if that person is not suffering from those things, they're taking non-addictive medication, that's another bonus on our way to, trying to see, if these things can work, as opposed to alcohol or, substances, illegal substances, to try and treat themselves with that. Um, we also want to know about the family too. Are you married? Are you divorced? Do you have kids? Um, what's going on there? Tell me about your parents. What's your relationship like with them? So we're trying to see if there's any friction, if the parents are still loving and caring and supportive, or if it's a spouse, like, where are you at with that? What is your custody arrangement? Are you getting to see the kids? Are you not getting to see the kids? All of that. And then education is important. Um, and this disease affects people from all walks of life, no matter what their education is. But it's just, most people that we see are very intelligent. I don't care where they went to school or how much school they went to. People that are very bright, and above average wage earners. So, I think a lot of times people think that we are, bums that make poor choices and live under, a bridge. And so that leads me to, what is your present living situation? Where are you living? Are you living in a house, an apartment? Are you living alone? Are you living with somebody else? Um, and tell me what's going on with that. And that's real important, as well as, your children. How old are they? What's your relationship like with them? And also, we just want to see also if there's any social or leisure activities that people enjoy doing or enjoy doing in the past. Typically, what happens, like say you're a golfer and a fisher and a hunter, or you like to surf. As the disease progresses, typically a lot of these activities go away. Maybe not go away completely, but you're doing it a lot less often because you've really kind of given your life over to the drugs or the alcohol. So it's really good if people have things that they enjoyed doing in the past that they've now let up on, because if they get into good sobriety, it's not like you're forcing them to go play golf, go surfing, go fishing, go hunting, because those are things that they enjoy doing. And that's really important. And then we also want to take a look at your spiritual condition. Are you somebody who believes in God? Do you believe in a higher power? Do you have, a spiritual peace in your life? And for those that do, it makes it a little bit easier. Although I hear many people say that that relationship with God, higher power, also kind of gets strained during this period of time while they're using. So, it's another opportunity to fill that void of the drugs and the alcohol um, when you when you stop drinking. Um, and then I think it's important to talk about goals. Like what are your goals? What would you like to do? Is there anything like on your wish list or that you would like to do? Because a lot of times we procrastinate. We can write down a bunch of things that we'd like to do, having a few drinks. Hey man, I'm gonna go do this. And then the next day it's just like, I don't want to do any of it. So it's important to have goals, something to look forward to. And I think you can start to achieve those goals in sobriety, no more procrastination, and that boosts self-esteem and it stops you from being your own worst critic, if you will, because you feel better about yourself. Um, and so it's also important to ask the person about, what they consider to be their strengths. And a lot of times people, when they're in the midst of their addiction, have a tough time identifying these things. They can identify a lot of things that they did wrong, but they can't identify their strengths. But we do have strengths. I have one in front of me where the guy said, I'm a loyal friend, I'm patient, non-judgmental, forgiving. I'm a good mom, and I'm hardworking. But then we go to, the needs and the weaknesses. And a lot of times we see that the self-esteem is low, but the self-esteem improves rapidly once they stop drinking because they all have a moral compass. And when I say they, us have a moral compass. And as much as we don't want to do it, we continue to do it, and then we're upset with ourselves that we're doing it, and that just adds, more fuel to the fire in terms of the drinking, and then the self talk becomes, I'm a bad person. So self critical. So self esteem, low self esteem, and being self critical are the two that I see a lot when people come into treatment. They're really down on themselves, and so all these things, we can kind of sort them out and say, wow, okay, here's where we have opportunities, maybe some medication assisted treatment along with counseling would really be helpful for this person. Of course, abstinence along with that, to try and make some progress. Or, you know, uh, this person's in between job opportunities, how can we help in terms of giving them directions, and finding out what they would like to do so that they can put together a resume or a CV and, start applying for jobs. Um, and then, making amends and reconciling with family. That's just such a beautiful thing to watch. And, despair becomes hope for family members. And, and then people are reunited with their families and things get better. It's not easy, but it gets better, and it's a whole hell of a lot better than it was, in the midst of the addiction. And then the medical things, really need to address those. Let's remove the alcohol. Does the blood pressure go down? Does the sugar numbers of diabetes get better? Is your AFib or your heart situation all of a sudden go away? Alcohol affects all of these things. And if you stop drinking, I guarantee you your liver enzymes will go down. Not 100% of the time, but probably 95% of the time, liver enzymes do go down, and your liver will start to recover, because we do not want you going down that path of um, fatty liver fibrosis, cirrhosis of the liver. And cirrhosis of the liver is just really a horrible way to go. So, but anyhow, so that's what a substance use evaluation is all about. And for those of you that are family members and were curious about, what the whole process is, it's pretty simple. It's pretty straightforward. There's other objective testing that can be done, to get a scale of where things are at. But, it's nice to hear from the person, especially if they have willingness to get some help. And, some of them are not great historians, and when I say that, I don't think that people are trying to be less than honest when, they come in to get an evaluation, either for individual counseling, outpatient counseling, residential treatment. And so it's important to the evaluator or to the counselor so that they can formulate what's called a treatment plan. And so everybody is different, right? Some people may have a marriage that's hanging by a thread. Okay, we need to work on that. Some people may have some serious health conditions. Okay, how do we address that? So it's not just all about stopping the alcohol and stopping the drugs. Let's see what's going on with this person, what areas need to be addressed, and then we can formulate a treatment plan with small, achievable goals, as opposed to going from A all the way to Z. Let's just take small baby steps, which improve self-esteem and helps you become self-critical every time you can cross one of these things off your list. And, the hope is that people will stay engaged long enough to reap the benefits of sobriety: better sleep, feeling better physically, more energy, eating properly, improve relationships with family members, improve relationships with yourself, improve relationships with a spiritual connection to a higher power or God. Now, you don't have to believe in God to get well, because this is not an exclusive uh, club, if you will. We have members that are agnostic, we have members that are atheist. But if you have that spiritual piece, sometimes it can make it a little bit easier, but that does not mean that you can't get sober if you're not, so inclined as to be spiritual and or religious. But so that's about it for substance use evaluations and formulation of a treatment plan. And if you have any questions, please contact us at info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. If there's any questions that we can answer for you, be happy to do that. If you'd like to meet with us, you can click on there. There's a free consultation where Di and I will get on with you, and you can kind of tell us what's going on, and we can let you know whether or not we think we can help you help yourself. Also, check out on our website, there's a family survival kit on there, and there's several articles that are, I think, really helpful to help family members kind of manage this whole situation. And you can download those for free. I think they're in PDF files and you can print them out. But okay, well, that's it for substance use evaluations and treatment plans. And let's hope that everybody, moves in that direction, because it's the way that families heal. So again, this is Dr. Brian Jackson for Healing Families Shattered by Addiction, and we will talk to you soon. Thank you very much.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.